Question 1. In the context of radiation shielding in nuclear medicine, which of the following is the primary principle behind using lead shielding for gamma radiation? A. Lead has a high atomic number which allows it to absorb gamma radiation effectively. B. Lead emits gamma radiation, which helps in shielding other sources of radiation. C. Lead has a low density, which helps in minimizing radiation exposure. D. Lead is biologically inert and does not interact with gamma radiation. Answer. Correct answer. A. Lead has a high atomic number which allows it to absorb gamma radiation effectively. Explanation. Lead is commonly used for shielding against gamma radiation due to its high atomic number Z, which increases the likelihood of gamma photons interacting with the material. These interactions, primarily through processes such as Compton scattering and photoelectric absorption, reduce the intensity of gamma radiation. This is why lead is material of choice in radiation protection. Option B is incorrect because lead does not emit gamma radiation, rather it absorbs it. Option C is incorrect because it implies that the low density of lead is beneficial, which is not true for gamma radiation shielding. Option D is incorrect because lead does interact with gamma radiation, facilitating its absorption and attenuation. Question 2. From a practical standpoint, when preparing a radiopharmaceutical for clinical use, which of the following factors is most critical in ensuring its effectiveness? A. The radiopharmaceutical's half-life should align with the imaging procedure's duration. B. The radiopharmaceutical should not exhibit any form of radiolabeling. C. The radiopharmaceutical should be stored at temperature below room temperature at all times. D. The radiopharmaceutical's radioactive decay should result in beta emissions only. Answer. Correct answer. A. The radiopharmaceutical's half-life should align with the imaging procedure's duration. Explanation. The half-life of radiopharmaceutical is crucial for its effectiveness in clinical imaging, as it must be long enough to allow for the imaging process to occur, but not so long that it results in excessive radiation exposure to the patient. Option B is incorrect because radiolabeling is necessary for the radiopharmaceutical to target specific tissues or organs. Option C is incorrect because while temperature control is important, it is not as critical as the half-life in ensuring the radiopharmaceutical's effectiveness. Option D is incorrect because most radiopharmaceuticals emit gamma radiation, not beta radiation, to be detected by imaging equipment. Question 3. Given the circumstances when a nuclear medicine technologist is preparing for a PET scan using FDG, which of the following factors must be considered regarding patient preparation? A. The patient should be given a high-carbohydrate meal to enhance glucose uptake. B. The patient must be kept fasting for at least 4-6 hours before the procedure. C. The patient must remain hydrated during the scan to improve image quality. D. The patient should be instructed to avoid all physical activity 48 hours before the procedure. Answer. Correct answer. B. The patient must be kept fasting for at least 4-6 hours before the procedure. Explanation. Fasting for 4-6 hours before an FDG PET scan is crucial to ensure that the patient's glucose levels are sufficiently low, allowing for better uptake of the radiopharmaceutical into tissues. This fasting period minimizes the competition between blood glucose and FDG, which is taken up by cells during imaging. Option is incorrect because high-carbohydrate meal would elevate glucose levels, making it difficult for FDG to be absorbed effectively. Option C is incorrect as hydration is generally not major concern for FDG uptake. Option D is incorrect because while avoiding heavy physical activity before the scan is important, 48-hour restriction is unnecessary for FDG imaging. Question 4. Considering the evidence on dosimetry calculations when calculating the dose for a therapeutic application using I-131, what must be factored into the calculation? A. Only the patient's weight and height are required to estimate the appropriate dose. B. The biologically effective dose bed must be considered along with the physical dose delivered by the radiation. C. The dose calculation should ignore the volume of tissue being irradiated. D. The dose calculation only considers the energy of the emitted radiation without regard to tissue-specific factors. Answer. Correct answer. B. The biologically effective dose bed must be considered along with the physical dose delivered by the radiation. Explanation. Dosimetry calculations for therapeutic radiopharmaceuticals like I-131 require consideration of both the physical dose delivered due to the radiation energy and the biologically effective dose bed, which accounts for the varying sensitivities of different tissues to radiation. This ensures that therapeutic dose is effective while minimizing damage to healthy tissues. Option is incorrect as only weight and height are insufficient. More parameters such as tissue sensitivity must be considered. Option C is incorrect as the volume of tissue radiated significantly impacts the dose calculation, especially in therapeutic applications. Option D is incorrect as tissue-specific factors such as radiation absorption are essential in accurately calculating the dose. Question 5. During the process of radiation detection, which of the following is true about the function of scintillation detectors in nuclear medicine? A. Scintillation detectors are used to measure the total energy of the emitted radiation without distinguishing between different types of radiation. B. Scintillation detectors only detect beta radiation and cannot be used for gamma or alpha radiation. C. Scintillation detectors convert radiation energy into visible light, which is then converted into an electrical signal. D. Scintillation detectors are used primarily for the quantification of dose rate, but not for imaging purposes. Answer. Correct answer. C. Scintillation detectors convert radiation energy into visible light, which is then converted into an electrical signal. Explanation. Scintillation detectors work by converting the energy of radiation, usually gamma or beta radiation, into visible light through a scintillator material. This light is then converted into an electrical signal by a photomultiplier tube, which is used for both quantitative and qualitative analysis. Option is incorrect because scintillation detectors can differentiate between types of radiation depending on the scintillator material used. Option B is incorrect because scintillation detectors are capable of detecting both gamma and beta radiation. Option D is incorrect because scintillation detectors are widely used for imaging purposes, such as in gamma cameras for acquiring images. Question 6. The prevailing attitude toward radiation protection for therapy patients is based on which principle? A. Maximizing the exposure to radiation to ensure maximum therapeutic effect. B. Using the least amount of radiation necessary to achieve the therapeutic goal, a Lara principle. C. Focusing on minimizing patient discomfort without regard to radiation dose. D. Administering high doses of radiation to target the tumor while ignoring surrounding tissues. Answer. Correct answer. B. Using the least amount of radiation necessary to achieve the therapeutic goal, a Lara principle of explanation. The ALARA, as low as reasonably achievable, principle is central to radiation protection, including for therapy patients. It dictates that the radiation dose should be kept as low as possible while still achieving the therapeutic goals. This is essential for minimizing the risks of radiation-related side effects and ensure patient safety. Option is incorrect because maximizing radiation exposure is contrary to the ALARA principle. Option C is incorrect because while patient comfort is important, radiation dose optimization is the priority. Option D is incorrect as it disregards the principle of minimizing damage to surrounding healthy tissues. Question 7. Based on the information regarding radiation interaction with matter, which of the following statements about the photoelectric effect is true? A. The photoelectric effect primarily involves the emission of alpha particles from an atom. B. The photoelectric effect is more likely to occur with low atomic number materials. C. The photoelectric effect results in the absorption of a photon and the ejection of an electron from an inner shell. D. The photoelectric effect does not contribute to the attenuation of X-rays or gamma rays in matter. Answer. Correct answer. C. The photoelectric effect results in the absorption of a photon and the ejection of an electron from an inner shell. Explanation. In the photoelectric effect, an incident photon is completely absorbed by an atom, causing the ejection of an electron from one of the atom's inner shells, typically the K or L shell. This interaction plays a significant role in the attenuation of X-rays or gamma rays. Option is incorrect because the photoelectric effect does not involve alpha particles. Option B is incorrect as the photoelectric effect is more likely to occur in materials with a higher atomic number Z, as the probability of interaction increases with Z. Option D is incorrect because the photoelectric effect contributes to the attenuation of radiation in matter, particularly in high Z materials. Question 8. When analyzing the biodistribution of a radiopharmaceutical in a patient, which factor is most likely to influence the localization of the drug in the target organ? A. The patient's age and gender. B. The physicochemical properties of the radiopharmaceutical, such as its lipophilicity and molecular size. C. The patient's hydration status during the scan. D. The type of radiation emitted by the radiopharmaceutical. Answer. Correct answer. B. The physicochemical properties of the radiopharmaceutical, such as its lipophilicity and molecular size. Explanation. The biodistribution of a radiopharmaceutical is significantly influenced by its physicochemical properties, including lipophilicity, fat solubility, and molecular size. These factors determine how the drug will interact with different tissues, which ultimately affects its localization in the target organ. Option is incorrect because while age and gender may have some influence, the physicochemical properties are more critical in determining biodistribution. Option C is incorrect because hydration status does not have a significant impact on localization compared to the drug's inherent properties. Option D is incorrect because the type of radiation emitted, gamma, beta, etc., does not directly influence where the drug localizes. Question 9. Under the assumption that a nuclear medicine technologist is performing a SPECT scan, which of the following would be considered an important consideration for image quality? A. Ensuring that the patient is well hydrated before the procedure. B. Ensuring that the SPECT camera is properly calibrated and tested for accuracy. C. Administering a higher dose of radiopharmaceutical to achieve clearer images. D. Positioning the patient as far away from the camera as possible. Answer. Correct answer. B. Ensuring that the SPECT camera is properly calibrated and tested for accuracy. Explanation. Proper calibration and testing of the SPECT camera are crucial for obtaining high-quality images. Accurate positioning, energy calibration, and system performance all play a role in ensuring optimal image quality. Option is incorrect as hydration generally does not have a direct impact on image quality in SPECT. Option C is incorrect because administering a higher dose of radiopharmaceutical does not always correlate with improved image quality and can increase patient exposure unnecessarily. Option D is incorrect as positioning the patient closer to the camera generally improves image resolution and quality. Question 10. In light of recent developments in nuclear medicine technology, which of the following is a significant advantage of PET imaging compared to standalone PET imaging? A. PET provides functional imaging only without anatomical information. B. PET combines metabolic information with detailed anatomical information, allowing for more accurate localization of pathology. C. PET reduces the overall radiation dose to the patient compared to standalone PET. D. PET imaging is faster but less accurate than standalone PET. Answer. Correct answer. B. PET combines metabolic information with detailed anatomical information, allowing for more accurate localization of pathology. Explanation. PET imaging combines functional imaging metabolic activity from PET with anatomical information from CT, resulting in more accurate localization and characterization of pathological areas such as tumors. Option is incorrect because PET provides both functional and anatomical data. Option C is incorrect because the addition of CT does not necessarily reduce the radiation dose but can provide better diagnostic accuracy, potentially reducing the need for follow-up tests. Option D is incorrect as PET is generally more accurate and comprehensive than standalone PET. Question 11. The underlying principle of nuclear medicine imaging is based on the detection of radiation emitted from within the patient's body. Given this, how does the type of radiopharmaceutical used affect image quality and diagnostic accuracy? A. The chemical properties of the radiopharmaceutical determine its biodistribution, and mismatch can lead to non-specific uptake, reducing image specificity. B. The gamma emission energy should ideally match the detector's peak efficiency. Otherwise, excessive attenuation or scatter can degrade image quality. C. The half-life of the radiopharmaceutical must be long enough for adequate imaging time, but short enough to minimize patient exposure and unnecessary radiation burden. D. All of the above. Answer. Correct answer. D. Explanation. Radiopharmaceuticals must be carefully designed to achieve optimal biodistribution, gamma emission properties, and half-life duration to balance image clarity and patient safety. If the chemical properties do not match the intended target organ, non-specific uptake may occur. The gamma energy should be within the optimal detection range 100-300 Kev for gamma cameras. Additionally, short isotopes such as Tc99 meters, half-life 6 hours, allow for imaging while minimizing long-term radiation exposure. Question 12. In a PET imaging study using ADD, a patient has a history of poorly controlled diabetes. What adjustments should be considered to improve diagnostic accuracy? A. Delay imaging by several hours to allow FDG uptake to stabilize. B. Administer additional insulin to normalize blood glucose before the scan. C. Perform a dynamic imaging study instead of static imaging. D. Use an alternative radiotracer that does not depend on glucose metabolism. Answer. Correct answer. D. Explanation. FDG uptake is directly influenced by blood glucose levels. In hypoglycemic patients, FDG uptake by malignant cells is reduced due to competition with endogenous glucose, leading to false negative results. While insulin can regulate glucose, administering it just before imaging may drive FDG into muscle instead of tumors, further reducing diagnostic accuracy. Delaying imaging is not a reliable correction method. Instead, alternative tracers like F18 fluciclovine or GOS68 dotatate, which do not rely on glucose metabolism, may be considered. Question 13. When considering the use of collimators in SPECT imaging, which factor most significantly affects spatial resolution? A. The septal thickness of the collimator. B. The distance between the source and the collimator. C. The type of radionuclide used. D. The number of image projections acquired. Answer. Correct answer. B. Explanation. Spatial resolution in SPECT imaging is inversely related to the distance between the source and the collimator. As distance increases, photon divergence causes image blur, reducing resolution. Although septal thickness and radionuclide energy affect image quality, their influence on spatial resolution is secondary compared to source to collimator distance. Acquiring more projections improves signal quality but directly compensate for poor resolution due to increased distance. Question 14. A technologist is preparing a TNT9 meters radiopharmaceutical for patient administration. Which of the following is the most critical step to ensure optimal radiochemical purity? A. Verifying the molar ratio of ligand to radionuclide. B. Ensuring proper pH balance during preparation. C. Performing a chromatography test before administration. D. Using a high-energy collimator for imaging. Answer. Correct answer. C. Explanation. Radiochemical purity testing is essential to ensure the radiopharmaceutical is correctly labeled and free from unbound pertechnetate or hydrolyzed impurities, which can cause non-specific uptake. Chromatography methods such as ITLC, instant thin layer chromatography, are routinely performed before administration. While pH and molar ratios are important for synthesis, they do not replace direct purity testing. High-energy collimators are irrelevant for TC99 meters imaging. Question 15. What factors contribute to the accuracy of a sous vide standardized uptake value calculations in PET imaging? A. Patient weight and injected activity. B. Image reconstruction algorithm and scatter correction. C. Timing of imaging relative to injection. D. All of the above. Answer. Correct answer. D. Explanation. Sous vide calculations depend on multiple factors, including patient weight, injected dose, timing of imaging, and post-processing techniques. If imaging is performed too early, the tumor uptake may not reach equilibrium, leading to underestimation. Additionally, scatter correction and attenuation correction influence quantitative accuracy. Question 16. In light of recent developments, which of the following is the primary challenge in theranostic applications of radiopharmaceuticals? A. Achieving selective tumor targeting while minimizing normal tissue toxicity. B. The high cost and limited availability of theranostic agents. C. The need for personalized dissymmetry to optimize treatment efficacy. D. All of the above. Answer. Correct answer. D. Explanation. Theranostic radiopharmaceuticals combine diagnostic imaging with targeted radionuclide therapy, requiring precise targeting of tumor cells while minimizing normal tissue exposure. Additionally, the high cost and production constraints limit widespread clinical adoption. Personalized dosimetry is critical to ensuring that each patient receives an optimal therapeutic dose. Question 17. What is the primary reason why F18 is preferred over C11 for PET imaging of metabolic processes? A. F18 has a longer half-life, allowing for easier radiopharmaceutical distribution. B. F18 produces higher energy positrons, improving resolution. C. F18 requires less shielding than C11, making it safer. D. C11 is more expensive to produce. Answer. Correct answer A. Explanation. F18 has a half-life of 110 minutes, whereas C11 has a much shorter half-life of 20 minutes. This makes F18 more practical for large-scale distribution and clinical use, as C11 requires on-site cyclotron production. The positron energy of C11 is slightly lower, which actually improves resolution, but its short half-life remains a major limitation. Question 18. Which of the following best describes the function of a pulse height analyzer in nuclear medicine imaging? A. It adjusts detector gain to improve spatial resolution. B. It filters out unwanted energy levels to enhance image contrast. C. It compensates for scatter by modifying collimator parameters. D. It prevents detector saturation from high energy radiation. Answer. Correct answer B. Explanation. The pulse height analyzer selects photons within a specific energy range, rejecting scattered photons that would degrade image contrast. This energy discrimination is crucial for improving image quality in gamma camera and PET imaging. Detector gain and collimator parameters affect other aspects of imaging but are not functions of the pulse height analyzer. Question 19. When performing a ventilation perfusion (VQ) scan, what is the primary advantage of using TC99 m/mar over Z133? A. TC99 m/mar provides better spatial resolution. B. TC99 m/mar does not require a specialized ventilation chamber. C. TC99 m/mar can be used for both ventilation and perfusion imaging. D. TC99 m/mar has a longer half-life, allowing delayed imaging. Answer. Correct answer A. Explanation. TC99 m/mar is used for perfusion imaging and provides higher spatial resolution compared to Z133 gas. Z133 is preferred for ventilation imaging due to its rapid washout, but suffers from poor resolution and requires a closed breathing circuit. Question 20. In PET imaging, which of the following factors most significantly impacts lesion detectability? A. Positron range. B. Scanner sensitivity and resolution. C. Radiopharmaceutical uptake kinetics. D. Patient movement during imaging. Answer. Correct answer B. Explanation. Scanner sensitivity and spatial resolution play a crucial role in detecting small lesions, while positron range, tracer kinetics, and patient motion affect image quality. They are secondary to detector resolution in determining lesion detectability. Question 21. Which of the following factors most significantly affects the spatial resolution of PET imaging? A. The number of detected coincidence events. B. The detector crystal thickness and intrinsic resolution. C. The patient's metabolic rate affecting radiotracer uptake. D. The reconstruction algorithm used for image processing. Answer. Correct answer B. Explanation. The spatial resolution of PET imaging is primarily determined by the detector crystal thickness and intrinsic resolution. Thicker crystals increase sensitivity but reduce spatial resolution due to increased positron range and depth of interaction effects. While the number of detected coincidence events affects image noise, it does not directly impact resolution. Question 22. A patient undergoing a bone scan with TC99 m/MDP shows increased uptake in the kidneys. What is the most likely explanation? A. The patient has metastatic bone disease. B. The patient has poor renal function leading to delayed radiotracer clearance. C. The patient has osteomyelitis increasing soft tissue uptake. D. The patient had prior bisphosphonate therapy affecting tracer distribution. Answer. Correct answer. B. Explanation. TC99 meters MDP is cleared by the kidneys, and increased renal uptake suggests impaired renal function, leading to prolonged tracer retention, while bone metastasis and osteomyelitis increase tracer uptake in affected areas. They do not explain diffuse renal uptake. Bisphosphonates affect bone turnover but do not directly cause increased renal uptake. Question 23. What is the primary advantage of using iterative reconstruction over filtered back projection in SPECT imaging? A. Iterative reconstruction reduces image noise and improves contrast. B. Iterative reconstruction is computationally less demanding. C. Iterative reconstruction eliminates the need for collimators. D. Iterative reconstruction provides higher sensitivity than PET imaging. Answer. Correct answer. A. Explanation. Iterative reconstruction improves image quality by reducing noise and enhancing contrast, leading to better lesion detectability. It is computationally intensive compared to filtered back projection. Collimators are still required in SPECT, and PET generally has higher sensitivity than SPECT. Question 24. A patient undergoing a thyroid scan with TC 99 meters per technetate shows high uptake in the salivary glands, but low uptake in the thyroid. What could be the cause? A. The patient has a non-functioning thyroid nodule. B. The patient is on high-dose iodine therapy. C. The patient has a thyroglossal duct cyst. D. The patient has Graves' disease. Answer. Correct answer. B. Explanation. TC 99 meters per technetate is taken up by both the thyroid and salivary glands, but high iodine levels can competitively inhibit thyroid uptake. Non-functioning nodules appear as cold spots. Thyroglossal duct cysts do not take up tracer, and Graves' disease typically shows diffusely increased uptake. Question 25. In myocardial perfusion imaging and PIA, WISE, a pharmacologic stress agent such as adenosine used instead of exercise in some patients. A. It directly increases myocardial oxygen demand. B. It induces coronary vasodilation, simulating exercise-induced hyperemia. C. It increases heart rate more than physical exercise. D. It enhances left ventricular ejection fraction measurement. Answer. Correct answer. B. Explanation. Pharmacologic agents like adenosine, dipyridamole, or regadenoson induce coronary vasodilation, creating a flow differential between normal and ischemic myocardium. They do not directly increase myocardial oxygen demand like exercise does. Question 26. When performing a lung perfusion scan using TC 99 meters MAR, why must the radiopharmaceutical be gently agitated before administration? A. To prevent aggregation of particles, which can cause non-uniform lung perfusion. B. To reduce the radiation dose to the lungs. C. To enhance radiotracer uptake in embolized regions. D. To improve collimator sensitivity during imaging. Answer. Correct answer. A. Explanation. TC 99 meters MAR consists of microparticles that, if not properly mixed, can clump together and cause localized overconcentration, leading to non-uniform lung perfusion. Proper agitation ensures an even distribution of particles. Question 27. A patient undergoing GOS67 imaging for infection shows diffuse soft tissue uptake. What is the most likely explanation? A. The patient has widespread bacterial infection. B. The patient received a recent blood transfusion. C. The patient has lymphoma. D. The patient is receiving iron therapy. Answer. Correct answer. D. Explanation. GOS67 binds to transferrin, and increased circulating iron from supplementation can lead to diffuse soft tissue uptake. Blood transfusions may increase liver uptake, but they do not cause diffuse soft tissue distribution. Question 20. In nuclear cardiology, why is TC 99 meters CertMedbry preferred over TL 201 for perfusion imaging? A. TC 99 meters CertMedbry has a lower radiation dose to the patient. B. TC 99 meters CertMedbry provides better myocardial viability assessment. C. TC 99 meters CertMedbry has a shorter biological half-life. D. TC 99 meters CertMedbry can be used for brain imaging as well. Answer. Correct answer A. Explanation. TC99 meters CertMedbry has a lower radiation dose than TL201 due to its shorter physical half-life, 6 hours versus 73 hours, and different energy characteristics. While TL201 is better for viability assessment, it delivers a higher radiation dose. Question 29. A nuclear medicine technologist is preparing FA in FDG for a PET scan. Which of the following steps is most critical in ensuring image accuracy? A. Checking the blood glucose level of the patient before administration. B. Using a higher dose of FDG to increase the image resolution. C. Imaging immediately after tracer injection to maximize signal strength. D. Storing FDG in an unshielded container to prevent decay. Answer. Correct answer A. Explanation. High blood glucose levels compete with FDG for uptake, reducing image quality and leading to false negative results. Imaging is performed after a waiting period 60 min for optimal uptake. Question 30. Inspect imaging. What is the primary advantage of using a fan beam collimator over a parallel hole collimator? A. Fan beam collimators improve image resolution by reducing scatter. B. Fan beam collimators increase system sensitivity by focusing more photons on the detector. C. Fan beam collimators eliminate the need for attenuation correction. D. Fan beam collimators allow imaging of multiple organs simultaneously. Answer. Correct answer B. Explanation. Fan beam collimators improve sensitivity by concentrating more photons on the detector, enhancing image quality. They do not eliminate scatter or the need for attenuation correction.